Hi everybody, I'm Pamela Atwood from Atwood Dementia Group. Welcome back to our Confident Caregiver Series, the A to Z's of Alzheimer's. Today we're talking about B, behaviors. This is one of the topics that I get asked about the most. So you found the right video. Don't forget to subscribe down below so that when we make a new video, you won't miss anything. The A to Z's is going to cover everything from abilities to zinc and aluminum. We'll cover joys and kids and falls and genetics and treatments and all kinds of things in these video series. If you have a question in particular, you don't have to wait until we get to the video. Feel free to go to atwooddementiagroup.com, and on the Contact Us page, just send me your question. I'll send you a personalized video to answer it. In the meantime, let's talk about behaviors. Why do people with dementia have behaviors? Well, behaviors is a form of communication. I've always said that until the last moment that they take a breath, a person with Alzheimer's can always tell us when they don't want to do something, and that's where we see a behavior. So behaviors are really a way of trying to communicate an emotion, a joy, a frustration, an anxiety, a worry, or pain. It's a lot of different things that are the meanings behind behaviors. Our job as confident caregivers is really to be a detective, to figure out what this behavior means. We have a couple of mantras, and in this series you're going to hear me share a lot of the mantras, and that's really a way of us trying to figure out and work with people who can't necessarily have the remaining ability to communicate rationally with us, so we have to adapt to them. In behavior management, what we have to do is we have to look at the mantra that we use is all behavior has meaning. So if all behavior has meaning, why did that person just push me away? Why did that person just swear? Why did that person just walk out the door? All behavior has meaning. So we don't want to just say, oh, that person is being manipulative, or oh, they're being stubborn, because that's not really true. The person with dementia is still the same person who was always there. Now, granted, some people who were stubborn, manipulative also get Alzheimer's. So sometimes that person is really just relying back on their pre-existing personality. But for a lot of people, the behavior that we see, they really can't be manipulative because that requires frontal lobe activity. And in the early stages of the dementia, that has really diminished for most kinds of dementia. So what happens with behavior management is we have to look at what triggered that behavior. In the professional world, when I'm training professionals, I say we look at the ABCs of behavior management. Behavior modification is a term you may have heard. Behavior modification means that we, like for instance, if we were training somebody like your kids or your pets, we would offer them a treat, or we would say, okay, if you do this, then you get that. That's behavior modification, and we're trying to modify someone's behavior by getting them to understand the consequences, or, for a reward. So with people with dementia, though, they don't always remember what's going to happen. So their very long-term memory may be intact, but their short-term memory or their future focus is really diminished. So when we're dealing with someone with dementia, we have to look at what's the meaning behind that behavior and then see what triggered it. So if it's a behavior we don't like, the only way that we can change it is by eliminating the trigger. And that's true for everybody. If my kid is whining because they're hungry, then I need to make sure that they're fed earlier. If my dog barks because the mailman came to the door, then I need to expect that that's going to happen and either take the dog out of the room when I know the mailman's coming, or get used to the fact that the dog is going to bark. I can't get mad at the dog because that's their natural instinct. So with my person with dementia, we have to look at the behavior. So I just mentioned wandering away. What made someone wander? Well, there are lots of reasons why people wander. Some people do it for exercise. Some people do it because they thought they saw something outside that they needed to attend to. Some people do it because they're confused and they're scared and they don't know who their caregiver is, so they're trying to leave to get safe. When my grandmother had Alzheimer's disease, at one point in the nursing home, we got a call. It was like 7 o'clock in the morning, and the facility said, Pam, I just wanted to let you know that we had an incident last night. Your grandmother hit one of the CNAs. And as a family member, you're devastated, and you say, oh my gosh, I'm so sorry. Is the CNA okay? And they said, yes, everybody's fine. And I said, wait. hold on, we're not done with this conversation yet. What happened? Tell me what happened. Well, it was 4 o'clock in the morning, and I thought, gee, that's strange because Graham usually sleeps pretty well. Why was my grandmother up at 4 o'clock in the morning? Well, they were doing her weekly skin assessment. Wait, what? So, okay, facilities have to juggle duties, and at the middle of the night, while they were changing my grandmother, they decided to check her skin integrity in her peri area and make sure she didn't have any skin breakdown, which is clinically very good care. But if they're waking her up in the middle of the night, don't be surprised then if she physically reacts, which is exactly what happened. I mean, don't we teach girls that, or teach anybody? Someone wakes you up in the middle of the night and has their hands in your privates, fight back. So that's the kind of thing that we need to look at. Does that behavior need medication or placement on a psych hospital? No, of course not. We just need to look at what was the trigger. The trigger was a stranger going in their hands and waking her up when their hands in her privates. That's a normal reaction to that behavior. Don't do the behavior. Or don't do the trigger, I should say. So a lot of times what we need to look at is what happened right before that behavior. So to do the ABCs of behavior management, don't worry about the C, the consequence. Don't worry about what comes after the behavior because we can't control that. What we can control is what came before. Sometimes, if someone has pain, we are only so good at dealing with the pain, but we need to look at that and we need to not just say, well, gee, according to their chart here, it says that they get Tylenol 3 times a day. That may not be enough. 85% of people in the community, 85% of seniors report substantial pain. That doesn't get cured by going to a nursing home or an assisted living. It's just that when the person has dementia, they can't complain about it as often. So a lot of times what we see are behaviors because someone doesn't feel good, they're feeling like they're in pain. So a lot of times the behaviors come from something like that. So behavior management isn't rocket science. There's some really great resources out there. A lot of what I do is behavioral consultations. So much of my day is spent brainstorming with families and with facilities staff to say, okay, what happened? Was there pain? Were they bored? Do they have a urinary tract infection? And we always blame the progression of the disease last. We look for biological, environmental, social, emotional, or spiritual triggers. What is going on? What is missing? What need is there that this person's trying to communicate? Do they need to go to the bathroom? Are they hungry? Are they lonely? Are they tired? We need to stop and look at what that person is trying to tell us. So that's the lesson for the day for our confident caregivers dealing with behaviors. Like I said before, make sure you subscribe on the button below and make sure that you let me know what you're thinking about this video series and letting me know if it's meeting some of your needs. Go to atwooddementiagroup.com and let me know, and maybe I'll respond with a personalized answer to your question. Thanks so much and have a confident day.